Alright guys, so we're going to look a little more into interpreting and analyzing results. But we're going to take a deeper look at relative risk, odds ratio, absolute risk, number needed to treat, absolute risk reduction, and risk relative risk reduction. So we're going to start out with a little review and then we'll learn to apply it. So first and foremost, in simplest form, most clinical questions are related to one or two issues. Whether a particular outcome differs from between groups who receive different interventions, or whether the outcome is associated with some other factor. When we are looking at dichotomous data, we are interested in learning the association between two variables that are measured on a nominal scale consisting of only two levels. Remember, nominal is categorical. They can only be in one or the other, and all the time, if you're looking at dichotomous data, the level of data has to be nominal. So let's look at a couple of examples of what that means. One example is, we may be interested in whether a risk factor is associated with the presence or absence of low back pain. Another example of that would be whether the use of a new mobility aid is associated with an increased likelihood that a patient will be discharged to home as opposed to discharged to a supervised care facility. For those two type of questions, you would generally look at chi-square. You can use other, but this is the most commonly used one. And with that, you're looking at the probability associated with chi-square that reflects the likelihood that an association between the two dichotomous or nominal variables is due to chance. Now remember, categorical is nominal for the level of data, and that's the only thing you can use for dichotomous data. So understanding the magnitude, also known as the effect size, is important to understanding the clinical relevance of a relation between two variables. You cannot say something is better without knowing how much, and you cannot say something is or isn't related without saying to what degree. How related are they? So when you're estimating the magnitude between dichotomous variables, you can use OR, which is odds ratio, and you can also use RR, relative risk, to assess the magnitude of association between a negative exposure, which is the risk factor, and disease. It's pretty much applied the same when you're looking in OT. An example of that would be looking at a risk factor of poor balance to a disease, which could be a fall or hip fracture. We assume that the outcome is a negative event, that the exposure may increase the likelihood of a negative event. So here's an example. You wish to estimate the association or an ergonomically sound workspace, subject that has a positive exposure or do not, and what you hope to find is a decreased likelihood of a negative outcome like carpal tunnel syndrome. What is the disease in this case, and what is the outcome, and is it positive or negative? For this example, your disease is going to be carpal tunnel syndrome, CTS, and the outcome is negative, but you anticipate that the exposure to the ergonomically sound workspace will decrease the likelihood of this disease. Let's look at a second example. You wish to estimate the association between a new intervention for athletes with ACR, whether it be treated or untreated, and the likelihood that the athlete will return to a sport or not. In this case, what is the positive outcome and what is the exposure? For this example, the positive outcome is to be able to return to the sport, or to degree of some other measure of success. Okay, so something close to returning to the sport, or as close to returning to the sport as possible. And the exposure for this would be the new intervention, because that's what you're looking at. So relative risk. Relative risk measures association between the presence or absence of disease and the presence or absence of exposure to potential risk factor. This is generally used in cohort studies where the exposure for all members of the cohort is looked at and the cohort is followed forward to determine later the disease status. So basically a group who has it and a group who does not. Now when you calculate relative risk, it's calculated by using a 2x2 contingency table, which we are and should be familiar by this time with the equations that you can see here. Now it looks a little weird, but we will apply it. So this is just for knowledge base. If the exposure does not affect disease occurrence, the incidence of disease will be similar for both exposed and unexposed individuals. So if you see a relative risk that equals 1, there's no association between the exposure and the disease. If the exposure does increase, an RR will be greater than 1 because the numerator will be larger than the denominator. And if this exposure provides some protection from disease, RR will be less than 1.0 because the denominator will be less than the numerator. Now, as you can see, I kind of stopped putting the actual words in the slides at this point because by this point, you should be very, very familiar with the vocabulary and recognizing what relative risk and what odds ratio is and the others just by using their abbreviations because this is what you're going to see most often. They may not always be spelled out, so you need to know what you're looking at. All right. So, let's do a little practice. In this example, you have, let's just say we have 100 subjects that were randomized to a structured program in which they were warmed up before the practice being the exposure, and 100 who did not warm up. Of those in the exposed group, 14 experienced a knee injury. Okay, that's this number, A. And 86 did not experience a knee injury, that's B. In the unexposed group, 27 experienced a knee injury, performed no warm-up, so that is the unexposed group, okay? And 73 did not experience a knee injury. So how would you calculate this? Well, if you remember, we said that the equation for relative risk was A divided by A plus B over C divided by C plus D. So in this case, it would be 14 whoops, sorry, let me go back here. So in this case, it would be 14, okay, divided by 14 plus 86. That's A divided by A plus B. Over C divided by C plus D, which would be 27, that's C, divided by 27 plus 73. Okay, so if you also, I don't know if you can see down here, but I've put that in here for you as well if you needed to see. But that's what you would use to calculate the relative risk. And as you can see, again, I have the equation down here. And this is what you should get when you put the whole thing together. You should come out with about 0.52. Hopefully you tried that. So what does that relative risk of 0.52 tells us? Well, one way to think about it is that the warm-up program was associated with a reduction of risk, which could be approximately 48%. Another way to look at it is that the warm-up program was associated with about 52% of the risk of the program in which subjects did not warm up. So we're looking at risk. The risk and the difference between warming up and not warming up. And we measure that relative risk. All right, now let's kind of talk about absolute risk reduction, which we really didn't talk a whole lot about the definition of what it is. But essentially, absolute risk reduction is attributable risk. We also need to know this because we need to know the difference between the numbers of relative risk. So when you're calculating absolute risk reduction, you're taking the 0.14, so you're taking A minus C, and you're coming up with a value. And again, it's essentially the same thing as looking at relative risk. We're going to use pretty much the same formula, but just in a different way. So here is that equation for you. So when we look at absolute risk reduction, we simply take the difference between the numerator and the denominator of relative risk calculation. From this example, it would be 0.14 minus 0.27, and we get negative 0.13. We can interpret that as a meaning that about 13 injuries will be prevented for every 100 who perform the warm-up program. And we're going to talk more about the number needed to treat, so I'm not going to go into detail using this example. I just wanted to give you an idea of what absolute risk reduction looks like. So just to familiarize yourself again, we said that the equation for calculating it, relative risk, was this. And we'll apply it again, don't worry. And looking at absolute risk reduction, this is the equation. Okay, so just to keep things moving, because we are going to go over this more using examples, I will keep going.